Hi, I'm Alex.
And I'm Stephanie.
And we'll be talking about Ballard Score. Ballard Score is important for establishing objective gestational age of a newborn. And it's broken down into two main sections, neuromuscular maturity and physical maturity. So we'll talk about both and then we'll do a quick example so you guys can see how to score a newborn. The first part of neuromuscular maturity is posture. So a larger for gestational age baby will have more of a frog-leg posture, be very flexed, whereas a score of 0 or 1 is a very flaccid kind of baby that just kind of lays there. Square window is the angle between their wrist and their forearm. In an older baby, they will have kind of a 0-degree angle, which means their fingers would be able to touch their forearm, and in a younger baby, their square window would be greater than 90 degrees. Arm recoil. If you hold the baby's arms down by their side and hold it there for a few seconds and then quickly release, if their arms do not recoil back up, then they would have a lower score of 0 or 1. But if they quickly recoil back to 90 degrees, then it would have a score of 3 or 4. For popliteal angle, that's the angle behind the bend of their knee. For a lower scoring baby, their angle would be very high, so 180 degrees, 160 degrees. And for an older baby, it would be lower than 90 degrees angle. Scarf sign is when you would take their arm and wrap it across their chest, and you're looking to see the elbow in relation to their midline. So a younger baby would have its elbow across midline to the other side, and an older baby, their arm wouldn't even come to midline or would be just past midline. Heel to ear. In younger babies, their heel can come all the way back and pretty much touch their ear with no resistance. And in older babies, their heel, if you try and pull it back towards their ear, they'll give you a lot of resistance and you won't be able to bend it very much.
Okay, moving on to physical maturity, you're going to be looking at their skin. So it ranges from thin and fragile all the way down to a 5, which will be very thick, leathery, and cracked. Also, you're going to be looking at veins in that section. For lanugo, this is the fine hair. So what's the amount that the baby has covering their entire body? For plantar surface, you're talking about the baby's heel. Take a look at the heel and see how much the creases cover. For breast, you'll take your pointer finger and your thumb and you'll pinch up the bud. This ranges in sizes 1 to 2 millimeters all the way to 5 to 10. Eyes and ears, you're going to be looking at the eyelids, and for ears, you're going to be looking at ear recoil. So you're going and folding the ear and seeing if it instantly recoils. For genitals, for males, you're looking at their testes to see if they've descended and also if there's rugae covering the scrotum. For females, you're wanting the majora to cover the clitoris and the minora.
Once you get all your scores, you can record them on the side and then chart it against their maturity rating. So a quick example.
So for this baby boy, he is well flexed in the frog position, so we gave him a 4. In his square window, he had a 45-degree angle. We gave him a 2. Arm recoil, he had 90-degree recoil. We gave him a 4. Popliteal angle, he extended a little over and got 140 degrees. We gave him a 1. On the scarf sign, it was midline, so he got a 2. And heel to ear, he went at about his umbilicus, so that was a 3. Total score of 16. In physical maturity, the baby had superficial peeling and few veins, so he got a 2. His lanugo was abundant. He got a score of a 1. In his plantar surface, his heels were completely covered in creases. That's a 4. Breast bud was 1 to 2 millimeters. That's a 2. Eye to ear, his ear was instant recoil. That's a 3. And for his genitals, his testes were descended and good rugae. So that's a 3. Total score of 15.
So you can add the score here. So for neuromuscular, 16, physical, 15. Added together, you have a total of 31. You go down to the maturity ranking chart and you find your score and then 31, and then you circle close to about the week. So for this baby, we would estimate that his gestational age is between 36 and 37 weeks.
It's important to remember that for the Ballard score, the dates fall between plus or minus 2 weeks for you planning and coordinating care.